We're ready?
Ready.
Good morning, everybody. Dan Bates, President and CEO of the Greater Hamilton Chamber of Commerce, and we are thrilled you could join us this morning. We have really interesting discussion coming up, and in just a minute, we'll introduce our speakers. But first of all, as I said, I'm Dan Bates. I'm the president, and I'll tell you a little bit of protocol here. For those of you who are on Zoom, you can ask questions of the speakers, either in the chat box or just ask them questions. If you're on Facebook Live, type those questions into Tiffany, and Tiffany will present those questions to the speakers to get them answered for you. So with that, let's find out who all is on the call this morning. Laura?
All right. Well, thank you, everyone. I'm so glad you could join us for Coffee and Conversations this morning. I'm Laura Merrill with the Greater Hamilton Chamber. Let's just go around and tell me your name and what company you're with. Nancy, we will start with you.
I'm Nancy O'Neill with the Greater Hamilton Chamber.
Jessica.
Good morning. My name is Jessica Brown. I'm with Edge Webware.
Steve.
Hello, everyone. Steve Wayne from Miami University Regionals.
Glad to have you with us today. Kim.
I'm Kim Neal Davis from Inspiration Studios Inside Out Studio.
Wonderful. Keyshawn.
I'm Keyshawn Sims with the Greater Hamilton Chambers.
Hello, Ann. Good to see you.
Hi, I know it's been a while. I'm Ann Arnett. I'm with Gateway Springs Health Campus.
She's back in her mobile office. And then Chris.
I'm Chris Cannell with the Hamilton City Schools.
Wonderful. So Connie, I will let you and your team introduce yourselves and take it from here.
Hi, I'm Connie Mehlman. I'm with Butler County Board of Developmental Disabilities. Courtney.
My name is Courtney Hyman. I'm also with Butler County Board of Developmental Disabilities.
And then I'm Patricia Dawson, also at the board.
Okay. Actually, I was just going to say a little bit about Connie. Connie is our presenter today, and she just celebrated her 25th year anniversary of working for the board. So congratulations. And she's also actively involved in Best Buddies at Miami University as the current chair of Best Buddies of Ohio. She lives here in Hamilton with her husband, Ted, for more than 25 years. And Courtney, who already introduced herself, is also active in self-advocacy and is a member of Best Buddies at Miami University. And her position is unique as that she not only serves on the board, but she also works for Butler County DD. So that being said, Connie, we're going to turn it over to you. I think that Courtney is going to come in at the end of the presentation to answer some questions. And Patricia, we welcome you as well. So let's get started.
Well, thank you so much for having us today. The first thing I'm going to do is share my screen, which Courtney and Patricia know that I am petrified of this, but we will see how it goes today because yesterday I practiced and it didn't go so well. So how am I doing so far? Do you see my screen?
Yes, we do.
Yes, we do.
Oh my gosh, I can't believe it. Okay. How's that? Are you seeing the whole screen?
You're doing great so far.
Yeah.
All right. Well, we're going to get started here today. We're so excited to be here.
Hey, Connie,
Yeah.
sorry. You do want to change your display settings.
It did what it did yesterday. So I need
Yeah.
to swap presenter
There you
view
go.
to slideshow. Okay. Thank you for that, Patricia. I really appreciate the help. She knows I do because Patricia helps me out on a daily basis. So as we were saying, we're with the Butler County Board of Developmental Disabilities, and we're excited to be here today to get to talk a little bit about what we do in the county and how we serve citizens who have disabilities within our community. Our mission is to support people so they can live, work, and learn in the community. And the word "the" is very important. Years ago, they used to say in their community, but it's the community because community is for everybody. We don't all have our separate little communities. We're one large community. So that's very important to us so that people know our mission within Butler County. Here are some of the services that we offer. We have SSA services, quality assurance and Medicaid services, family focus, community services, which is our favorite because that's our department, early intervention, and then employment navigation and employment supports. And as you can see up on the cute little picture of one of our recipients of services, we serve about 3,900 people within Butler County that are currently enrolled for services. I'm going to give you some information today. I don't expect you to remember it all, but I just hope it gives you a little background and education on what we do should you want to reach out to us if you know someone who needs our services, or if you maybe want to learn more about employing people with disabilities. The first group I'm going to mention is our early intervention group. Their eligibility is determined by a group you may have heard of called Help Me Grow with Butler County ESC. And I'm going to minimize our picture so I can see a little bit better here. There we go. So for people who might be at risk at a developmental delay from an early age, once the risk is identified and people are deemed eligible, then we are then considered the provider of the service, which means we do the on-hands work in the homes of the people that we serve. Currently, we are working about 900 children up to the age of 3 and their families every year. It's a unique teaching model, which a lot of people around the state have modeled after our staff at Butler County. It's a teach the parent or caregiver type of model. So when they go into the homes, they're teaching the families so they can work with their young child on a daily basis. And then they go back in on a regular basis to reassess, teach new things, and help people get ready for life for when they get ready for a preschool. So early intervention is a lot of fun. We love our cute little kiddos. And as our kiddos grow, they are eligible for what's called Service and Support Administration, which I referred to earlier as our SSA, which is a lot easier to say. It's also, if you would think about maybe a caseworker or case manager, that's a term you might hear in a lot of other industries, but across the state, they're called Service and Support Administrators. And currently, we're serving 2,675 individuals throughout Butler County. This person is their main point of contact. We help with eligibility determination. They develop plans for each individual so they can see what services are available to them and what services they want to access. We establish budgets for the needed services. And one thing that's really important to know about our agency, as we don't have as many buildings around the community as you used to see, our money follows the person. So we are very person-centered. And as when someone is eligible for services, they get an allotted amount of money, and then they get to choose what services and what providers they want to use so the plan best suits them. They also identify qualified providers of services. They maintain their benefits. Everybody hears about benefits and Social Security and SSDI and all these different acronyms. So our SSAs help the families navigate that process. And then we also help with crisis management. And we're not, in parentheses, it says not behavioral management, but it's crisis management. Say, for example, we have a family and they were new to us, and maybe it's an elderly parent and the parent passes away and there's a crisis because they don't have a plan in place, or something happens to a family member. We try to make sure everybody's prepared, or sometime we might get somebody who's brand new because the family decided that they thought they were best to manage everything. And we've had cases where someone maybe is 60 years old in the community and stayed at home with mom forever. And then here they are, and we have to get a plan in place. So they do really great job at crisis intervention and helping folks when they are in need of our service. Our SSAs also work alongside our quality assurance department. They monitor health and safety. They help refer our individuals to advocacy programs, or maybe find an advocate for them in the community that can work side by side. And as I mentioned about people not having a plan, we do assist families to make future plans. We have a great program right now that we're working on called The Future Is Now, that works with families and their loved one to prepare for the future, because as we know, we're not all around forever and everybody needs to have a plan in place. And when the plan is in place, it's a much easier transition for someone when they lose maybe a caregiver or a loved one, so that they know what's coming and they have informed decisions that they've made. And if anybody's asking questions, just let me know, or if you have a question as I go along, I don't mind to stop. We also have residential supports that our SSAs manage. They used to be called group homes. We don't call them that anymore. They're just a shared community living. Sometimes individuals live with 1 to 2 roommates to share expenses. Sometimes we have individuals, I mentioned earlier, Courtney, who's going to be open for questions later. She lives on her own in the community at 3rd and Dayton in one of those new apartments, and she gets some support there to help her have an independent life. Providers are identified to provide the needs in the home and supports. A lot of our supports are done through Medicaid waiver programs. I'm not going to go into great detail about that, but we do receive Medicaid dollars. And it's very important that anytime we accept the Medicaid waiver, we pay 40% of the funding match. So we always have to make sure that we're in line with our budget, that we can meet the 40% of the funding match, which the state and Medicaid provides 60%. So we don't overcommit, but we try to get as many waivers as we can. And I think we do a pretty good job at allocating our dollars to serve our individuals. And I'll touch on that a little bit later. So, and then other waivers are also provided through Ohio Department of Jobs and Family Services. So there's a lot of pieces to the pie that an SSA has to coordinate. It's a difficult job, but it's also a rewarding job to help people live their best lives. Residential supports, waiting lists for waivers. We have a pretty large waiting list across the state for people who would like to have residential placement. The last numbers I read, I believe it was around 10,000 people on a waiting list across the state that are looking for residential areas to live in, so they can be more independent, get out from under the wings of mom and dad if they choose to. If they don't want to, that's okay too. It's up to them. Some of our folks who I mentioned who choose to stay home with their families have a little bit more limited waiver that they get. It's a $5,000 maximum, and they get to choose how they want to spend that. They could have someone come into the house to help them learn to be more independent, maybe work on cooking skills or cleaning skills. Personal care. Sometimes we have folks who may need a little help getting ready in the morning or getting their apartment clean. If they have maybe some limited physical abilities. Transportation is a big issue always across the state and here in Butler County. We provide transportation dollars. We would love to have a larger, let's drop this hint, across Butler County, we'd love to have a larger public transportation system. I think it's grown vastly, but as that grows, it really helps our adults with disabilities who don't drive and need to get to work or maybe to social events. We work with employment and day hab supports, and day hab supports are our programs that are available out in the community. And I know Kim is tuning in today from Inside Out Studios. That's an art studio, but it's also a day program that helps support individuals to come to a program, have a meaningful day, create art, and then in turn they get a paycheck when their art sells. So that's just one example of a day program. Goodwill would be another, Easter Seals, and then a lot of private ones you would see throughout the county. And then we do have some people who still live in an intermediate care facility, kind of like a nursing home. And we have very few people that live in that setting, but it's normally because they have high medical needs. Quality assurance. Basically what quality assurance is, we have a team of people who are available to investigate if there's anything going on unusual with somebody who we're serving in the community. So as a member of the community, if you know of somebody who has a developmental disability, or sometimes people refer to as an intellectual disability, you can reach out to Butler County DD if you have a concern, and you can report it. You don't have to give your name, just like anybody else if you want to be anonymous. But if you're concerned, you report it to us, and we have agents who go out and do the family investigation. They work a lot with Butler County Children's Services, and they work a lot with our court system. So they're a very important piece of what we do, because this population of people with disabilities is probably the most abused population in the United States. A lot of people aren't aware of that, just because sometimes it's not always physical abuse, but someone might be taking advantage of somebody, their monetary issues, or not treating them nicely. So this is what this department does. I would say it probably is not the funnest job, but it's one of our most important jobs to make sure people are safe in the community. Family Focus is another part of our services that we provide. It's also another service that helps families at home or within the school district. And this is a program that focuses on individuals who may have some challenging behaviors at home or within the school district. We come in, they assess the situation, and they come up with plans to help the family deal with the issues. I think that all of us in our lives, we've dealt with different areas with our kids or things that have been going on, and some families have a little bit more to deal with. So this is nice that they can come in to help young people 24 and under learn how to manage their behaviors a little bit better, so they have a little bit better time in school or at home, and that makes everybody's lives easier, including theirs. Employment. I don't know how many people, I know everybody knows that everybody's got help when it signs up around the community. You see stories on the news. I wanted to give you one statistic. The national statistic for people with intellectual and developmental disabilities regarding employment, 81% are unemployed, which means there's only 19% of this population who are employed. And this is a very viable workforce of individuals who want jobs. They want to contribute to their community. They want to, believe it or not, they want to pay taxes. They want to do all the things that we're currently doing, but maybe just don't have as much opportunity, or businesses might still not be as open-minded because they don't know about this great untapped resource for employment. Back in 2012, Governor Kasich passed Ohio's Employment First initiative. And simply what that means is all of the agencies across our 88 counties concentrate on employment first for people when they're coming out of school, or versus going to a day program. And employment doesn't have to mean full-time. It can be somebody working 1 day a week up to 40 hours a week. And we have some of our individuals who work full-time and are working overtime. So it gives them a great sense of pride to be able to give back. It empowers them to be more part of their community. I don't know if anybody recognizes the young lady in this picture. Her name is Sandy Burns. She passed away last year, but Sandy was one of our first people employed for over 30 years at McDonald's in Oxford. And she was a strong person in her community, and everybody knew Sandy. And she always brings a smile to my face every time I see her. So we make it a priority to ensure that people we support have as many opportunities as possible to work in the community. There's just a couple pictures of people working, one at a clothing press and the other one taking tickets at a movie theater. Some reasons that you might want to hire somebody who has an intellectual or developmental disability: they are very loyal, skilled workers who really appreciate the chance to show you what they are capable of. And a lot of people that I talk to in the community that have employed our folks that we serve tell us that they always show up for work, they're positive, they don't complain about being at work. So what more could you want from an employee? Someone who wants to show up every day and do a good job. These are just a few of our partners within Butler County who have hired probably more than one individual with disabilities to work within their system. I'm sure if you knew people who worked at these different locations, they would have many positive things to say about employing somebody with a disability. I know my friends at Bilstein talk about all the time, if they could have, You know, several of our workers that have been there for a long time, if they could multiply them by 100, they would hire the people that have their same skills. So in our Butler County area, we have over 450 people currently employed at 200 locations. And I will say we are a little bit above the state average. Some of our other partners that you may have heard of that help our folks get ready for employment. We work a lot with Butler Tech, with Project Life and Project Search, which is a post-secondary opportunity for people to get more job skills. Sometimes they'll have, I don't want to call them enclaves, but on-site workplaces. I know they have one at Miami University. They've worked with many of the hospitals. They've worked with Ohio Casualty to get people skills and kind of really see what people want to do. Back in the day, people with disabilities got mostly jobs that were working in restaurants or janitorial. We had jobs that were available and we would just put people into a job so they could have a job. And thank goodness we've come full circle and we get to know the person first and what their likes and dislikes are, because we all want a job that we enjoy. And if you're an employer out there and you're thinking, you know, how am I going to include somebody with a developmental disability in my agency? How much time is that going to take, you know, on their supervisor? Well, we'd like to let you know that we have a job development program where we go out and we search for jobs, and then we find the person who has the best skills to meet that job. We provide job coaching. So when someone comes to have a job, for example, that is my friend Donald. He's been working at Kroger's for years. And when he first started there, he had a job coach working side by side with him to help him learn the skills that he needed to learn to do the job correctly, because everybody learns differently. And that's what our job coaches do. They come up with the technique on how to teach the job. And then we have what's called job retention, where people go in periodically and check on the person to see how they're doing, or if they're going to get, you know, maybe they're going to move up at Kroger's and learn how to stock shelves. So the job coach might come in and teach them how to do a new job, or maybe if they forgot a little bit about the current job and they just need a little fine tuning, the retention specialist comes back in for that. This is just another partnership that we have with Ohio Means Jobs. We work a lot with their folks. And I know we have somebody on from Miami University. This is our friend Chase. He works in Oxford at Miami and loves working in the dining halls. You might want to know where we get our money from. I'm assuming most of you know that we are funded by a levy. And I wanted to let you know that the reason you probably haven't seen our name around on any levies for a while is because we have not gone back and been on the ballot since 2004 and planning not to go back probably until 2023 or 2024. And I really don't know of any other county agency who has not been on the levy going back and asking for more money in that period of time. So we're really proud of the fact that we have a great department. Our business department forecast our budget 10 years in advance. So we know what's coming in and what our expenditures are and what we have left over to make sure that we're staying on track. And this year, we were lucky enough in the past 2 years, I believe, that we actually did a rollback to help out taxpayers during this time. We were doing good with our funds. So it wasn't a ton of money that you were getting back, but every household for every $100,000 that their home was valued at got $17 taken off their taxes. And hey, we all want to save money. So I think that's great. This is just a little pie chart that tells you that your levy dollars that you vote on directly here in Butler County, we get 77% of our dollars from local tax dollars, 19% is from federal, and 4% is from state. So that's kind of our little breakdown, and we're really proud of the fact of how fiscally responsible we are here at the agency. If you have, here's who is eligible for our services. To be eligible outside of the early intervention, the individual must be 6 years or older, and they must meet the following qualifications. They must be a resident of Butler County, so you have to live within the county. You have to have a documented qualifying diagnosis of a developmental disability. Have a physical or mental impairment other than mental illness. People sometimes get us confused with Butler County mental health. but we do serve some people who have a dual diagnosis. So they could have a developmental disability, such as autism, and then they may have a second diagnosis from something regarding mental illness. The onset of the disability must have been manifesting prior to the age of 22. So you have to be diagnosed prior to the age of 22, and the disability has to be something that's going to continue indefinitely. These are just some of the qualifying diagnoses. Somebody could have a mild, moderate, severe, or profound disability, cerebral palsy, autism, seizure disorder, pervasive developmental disorder, which you might hear sometimes called PDD, ADHD, a traumatic brain injury, and other things like Williams syndrome. There's a list. I could read 50 things on a list that would be a qualifying diagnosis. Some unacceptable diagnosis, like if a doctor just wrote somebody's a slow learner, they would not qualify for our services. They would have to have a qualifying diagnosis. Now, as I said, community services, which is dear to my heart because it's my department that I serve in. We are the folks that you see out and about, like at chamber events or other events, giving talks about what we do in the community, how we serve individuals in the community, and how you can get involved to have some fun with us. Courtney later is going to talk a little bit about, we have an advocacy group called Speak Up. We actually have a meeting tonight at 7 o'clock. And tonight in our group, we're going to be picking a community organization to do some volunteering with for the holidays. So sometimes we do things in the group where we're learning about ways we can give back. Primarily, we do things that teach people how to advocate for themselves and how to speak up for what they need, because it's their right to have all the things that we have in the community. So they need to go out and speak up and learn how to do that in a nice way. And they also learn about the responsibility of having rights. And we bring in guest speakers. We've had elected officials come in before. We recently had somebody from a bank talking about being responsible for your budget, because people have a right to earn money, but they also have to be responsible in how they spend it. Another group that we're highly involved with is Best Buddies. That's probably my most favorite thing that I do with my job. Best Buddies is an international program where we concentrate on friendship, and it's friendships between people with and without disabilities in the community. We have a chapter at Miami University, and we just had our matching program on Sunday, and we made 87 matches at Miami University. So we have large chapter events once a month, and then once a month, the matches go out and they just do something fun in the community. We're actually going to have an event at Inside Out Studios coming up in November for 10 of our matches to go and do an art project together. So they're looking forward to that. A few other things that we do, we have what's called the Give Back Crew, where people with and without disabilities go out in the community and they volunteer together. So if you have a group at your work that wants to go out and volunteer, but you also you want to give them a gentle introduction to learning about people with developmental disabilities, this is a great way to work side by side, hand in hand, just to do some good work in your community, but get to know each other. Sometimes we do things called instant picnics, like maybe the chamber would say, hey, we heard about your instant picnics. Do you want to throw one for us? And we come down with a tent and a grill, and we cook hamburgers, hot dogs, brats, and we just sit down and have a meal together. And that's all put on by some of our volunteers. We work side by side with Goodwill, and this is an easy way for every community member to get involved. We have what's called Goodwill Vouchers. So say Tiffany, I can't see Tiffany because I'm screen sharing, but when Tiffany's cleaning out her closet, because I know she loves clothes and she's going to go to Goodwill and drop some off, if she takes one of our vouchers with her, we get credit for that. And what that means is you're actually giving twice. She's giving to Goodwill, turns in our voucher, and then we get gift cards that come back to our agency. And then when we have somebody in need, we can give them a voucher to go shopping. I just gave out one yesterday. A young lady was starting a job and she needed some shoes. So she got a $20 gift card to go to Goodwill and get some shoes that she needed for work. So that's an easy way to get involved. And then currently, I am in charge of our holiday outreach, and I've had 73 families referred that need gifts for the holidays. And we provide gifts for individuals who receive services And if they have siblings under 18, we also get gifts for the kids because we want to make sure everybody has a happy holiday. And we also get gift cards for the parents to help, maybe do some extra grocery shopping. So I know Patricia's going to put my email in the chat if she hasn't done so. So if you work for a business or just as a family and you want to get involved with that, that is a great way to get involved with our agency. This is a program I really wanted to highlight today. It's called Best Buddies Citizens, and it's an opportunity for friendship for people with and without disabilities. And the Citizens program is something new we started a couple of years ago. We had our program going with Miami University, and we have a few high school chapters, but we had some adults who just didn't want to be part of the Miami University group because the kids are pretty young. So they wanted older matches or matches that had more in common or in similar in age. So as you can see, that is a photo of me, and my buddy's name is Amanda, and we get together once a month and we do something fun. I don't know if anybody can name that spot that we're located at. Can anybody name that spot? Anybody from the chamber know where we're at?
Is that Fenton Center in the background?
That is Fitness Center. I think,
Is that
yes.
Fretboard?
We're at Fretboard.
Fretboard. Gotcha.
On the patio. So as you can see, we go out and do everything that you would just do with any of your friends in the community. Mandy and I both like to have a good craft beer now and then. And when during COVID, when we weren't going out as much, I would go over to Mandy's house. We'd just sit out on the back porch and socially distant and bring a little cooler, have a little fun, talk about what was going on. And then the other picture happens to be my husband, Ted. He's the tall person standing there fishing, and that's his buddy, Paul. And I love this picture because Paul is not very tall. That is a tongue twister. And he's sitting in my husband's chair that's for big and tall. So you can see Paul's feet dangling from the chair, kind of like mine do if I sit in that chair, but they were out fishing together. So we're trying to find more agencies or businesses that would let us talk about this program. We're not looking for everybody to be involved, but we would love some new members because we do have a waiting list of people who just want to make a new friend. And that's not a hard thing to do, to go out and have fun and then call each other on the phone and text. And we have a good time together. Sometimes the four of us go out as well. So it's a lot of fun. So that really is the end of my formal presentation. I'm hoping you guys have some questions, and I am going to ask Courtney a few questions, and we want to thank you. And this is one of my favorite folks that works at Kroger's on the west side. His name is David. I'm sure a lot of you might recognize David. He's a fun person to be around. He goes to the Inside Out studio and he volunteers at Baden High School. And that being said, I'm going to stop sharing my screen and bring us back so we can all have a chat. Okay, did we have any questions from anybody?
I do. I have many.
Oh my.
So anybody else can interject. So first of all, one is not a question, it's commending you. I know it's hit the paper a couple of times because you've done it a couple of years in a row as far as, giving back excess funds that you don't need. And I don't know of anybody anywhere I've ever lived, any agency that has done that. So I commend you for doing that. My questions are, and going back to the first part of your presentation, when a caregiver, is planning for the future, okay, is there a professional, is that something you guys do when, if they're no longer able to do that or planning for their demise or whatever? Is that something the agency does? Do you bring a professional to do that? And if so, who does that?
Well, we do have a thing called The Future Is Now, which families can participate in. I believe it's a 16-hour program where they work on a plan going from beginning to end. And then we have a list of resources, like if somebody wants to do a trust to have their dollars appropriately allocated so they're not eaten up by the government when somebody passes away. We have a list of resources, but the support coordinator or the case manager works individually with each family. That being said, the family has to be willing to allow somebody to work with them. So it has to be, you know, a two-way street that the family is willing to open up and sit down and work with. You know, we can't force it upon people, but yes, we do provide those services, and we do refer them to the appropriate professionals to help them with that. We give them a list. We don't just say, here's the one lawyer in town that you need to go to, or because, you know, we would get in trouble if we did that. But we do find, and we do have presentations. There's a series of people that come in. It was called the SALT series, where we have where families can come and learn about trust and wills and guardianship versus not having guardianship. So there's a lot for families to learn. It's a complicated process, but the staff are here to guide them through it. Does that answer your question, Dan?
Yes, it does. But it brings me to another comment, and that is, I think that would be maybe a topic that could be a series of things to put in our e-newsletter or something like that to put out, because I'm sure there are a lot of families that don't think about that. For some reason, we all think we're going to live forever. I know I am. And, you know, they have responsibility for someone, and all of a sudden they're, you know, have a stroke or something and no longer able to care for them. And, you know, so I think that would be what we'd offer our newsletter, that if you would want to put, you know, kind of teaser phrases into that with a link to a larger article, I think that'd be really interesting for people.
Well, and I think another thing to mention just on that is not every individual that we serve has a family who's going to take over to care for somebody. You would like to think that if somebody has 3 or 4 siblings and mom and dad pass away, that they're going to step in. That doesn't always happen, because people have always asked me, why do you have why do you have homes where people live? Or why do you have this? Or why do you provide transportation? We have some people who are so fortunate, they have the best families, that their whole life revolves around the person that's receiving our services. Then there are times when I'm totally shocked, and I've been in this field for more than 25 years, but that a family member wouldn't want to step in. But that's why it's important for people to make the plans, because sometimes families assume that, you know, brother or sister are going to do this, or aunt and uncle, and it doesn't happen. So we would love, Patricia, I can see, is taking some information down there. She would be the person that would help put that together. So
the other comment I have is, you know, Tiffany also oversees the Hamilton Flea. And I'm wondering if that wouldn't be an opportunity to do like the picnic event for, you know, exposure and awareness, and, you know, and make it kind of open to the public at an event. And I know you couldn't do that probably all day, but just kind of threw that out there, that might be interesting to do.
Do something like that.
Yeah.
Yes, I would love to look into that.
Do the pop-up picnic at a Flea, and then you could have a booth for information and all that kind of stuff. So,
okay.
Sorry, Tiffany, I'm offering that up, but I think that'd be, because it'd be great exposure, I think, you know, for the clients that you work with, and I think it'd be great awareness for the public.
I love that idea. And it also might let people see their abilities of helping serve the community, and that might spark interest in someone, whether it's volunteering. We do a lot of volunteering for Metro Parks. You know, when we first started going there, I think they were a little apprehensive. We're like one of their #1 volunteers now. Don't like all the jobs they give us sometimes. If I have to shovel mulch or whatever. The first time we went, it was 2 dump truck loads of mulch. And I was like, oh, they really don't like us, but we did it. We got everybody organized. Even we had a gentleman who had no vision, was spreading mulch, so, and enjoyed it. So
He probably did a better job than I would spreading mulch, but
it was very smooth. There wasn't a bump. You know, he had very good tactical skills. So.
And then the last thing is for holiday gifts. Do you partner with other agencies like Salvation Army and stuff like that, or? You know,
we do not. I've often said there probably needs to be I don't know what you would call it, like a bank where you could go in and see if we're all serving the same families. Is that what you're getting to, Dan?
Yeah, because I know I lived in another community where they did that, and they had one agency, which just happened to be the Salvation Army, that coordinated for everybody. So
right. What we normally do here, the way our families are picked is the caseworkers, the SSAs know their families in the early intervention. They only refer the families that they know are in most need, that have a high need, that really probably wouldn't have a Christmas. And we always have to think in good faith that we are the only ones they're receiving a gift from. So, but usually a lot of things that our families are asking for. Last year, I had somebody asking for bath soap and shampoos and things like that. They weren't even asking for things that most of us would want for the holidays. So we try to do a pretty good vetting system. And with the 73 families that we have this year, we will probably be doing at least 300 gifts, and we usually do 2 per person. And some people also ask us, why do you include their other siblings, even if they don't have a disability? Well, I'm like, how would that look if the one child got gifts and the other didn't? So we do all the kids under 18. And then we just do the parents a gift card to Kroger or Walmart. So.
And then my last thing, and then I'll shut up, is, related to holiday gifts. Do you, reach out to organizations like Kiwanis and Rotary and stuff to, adopt some of these families? I know Salvation Army currently works with them, but, I think that I don't know if you do that already or not. I would think Kiwanis especially, would be an interesting, because they do Salvation Army. I think Rotary is more into Salvation Army than Kiwanis is. Just something to think about.
Yes, we do reach out.
I'm on the board of both.
Okay, well, I would
throwing
be
that out
happy
there.
to get you some information or let me know how to do that. We reach out to, we have what's called a Community Connections newsletter that goes out every other week. Patricia puts that together, and the next one we will be reaching out within the community. And I think we have about 4,000 people who get that newsletter within the community. We put it, last year, I will tell you, we were about 15 families short, and we put a thing out on Facebook, and within 2 days, I had everybody was taken care of, because that's a lot of stress on the person. If you're the one person who's trying to get all the gifts and you're looking at there's 15 left. And I also do a family and everything, but I told my husband, I said, you may be writing a big check here, but I was so pleasantly surprised at how fast the community responded. We have a couple long-standing relationships with First Financial and Phillips Edison, who take on a lot of our families. So we have a lot of companies who reach out, and then sometimes it's just individuals. They'll call and say, I want to do a family, or if I buy you $500 in gift cards, will you go shop? I did a lot of shopping last year during COVID because people didn't want to. So I did a lot of shopping, and it was fun. I did a lot of wrapping too, but and it's great to see the families get the gifts. The support coordinators deliver them directly to the homes. And sometimes we get little notes, or they'll say, the grandpa who was taking care of these kids, he was crying when we came to the door. And so people are really appreciative, I think.
I think it's a great comment on our community. I know last year, because more connected with Salvation Army, I know they got an overwhelming response, and actually received much more than they had anticipated. And gifts for families.
And I am definitely reaching out to your sources.
But that's great. It says a lot about our community. Last year was a pretty challenging year for a lot of people, but
Right.
when they saw the need, this community really responded.
Courtney, do you want to tell everybody just a little bit about what you do for the agency? As Dan mentioned, Courtney works for our agency, and she allows me to say that she also receives services through our agency, and she's our current community outreach advocate.
Yeah. So as Connie mentioned, I work for the Butler County Board of DD as the community outreach advocate. What I do for the board is I co-lead our self-advocacy group. It's called Speak Up. And I also go out into the community and tell others about the Board of DD. And
what about the boards you serve on, Courtney?
Yeah, I serve on the Partnership for Housing Board, and I also am on the Ohio DD Council.
And she was appointed by our current governor. That's a very prestigious board to be on. There's only probably 25 people from the state of Ohio on that board, and Courtney gets to go up and give her input on grants and dollars that are being allocated. And I always commend Courtney because she always is very prepared for those meetings. She reads everything. So she is a great person. And one compliment to Courtney, when we go out and do presentations, we thought we were going to Washington, DC right before COVID, the week before COVID. Well, everything shut down the following week. We were supposed to go to DC and meet with our elected senators, and we were trying to get in to meet with the president because Courtney and I are of the mind, it doesn't matter who's in office and what party they're with. Developmental disabilities awareness is a bipartisan issue. So we met with Sheriff Jones to see if he could get us in. And at the end, he loved the fact that when we go out and talk, he said, I love listening to you, Connie, and you know everything that the board does, but hearing somebody like Courtney who has received services to see the progress that she's made, having her come out in the community and spread the word is the best thing ever. So she even got to sit in his chair and get a great picture with the cowboy hat. So
Yeah.
So I just wanted you guys to let you know what Courtney does. And so trying to get her to go to the young professionals group in Hamilton. I'm pushing. So she needs to get out there. Do we have any other questions? I didn't mean to babble on there.
I have a quick question. So I know you guys are like the Butler County. I'm thinking about like bigger picture, like in all of Ohio, like are there the same organization as yours in every county? And how do you guys partner all together, or is it all done kind of separately?
Well, we have 88 counties, so there are 88 county boards of developmental disabilities. And I will say we are I believe we're the only state in the United States that has county boards of developmental disabilities. Every state hands out their services differently. Some of them are at a state level, some of them have districts. So I think Ohio has one of the best states for services for the population that we're serving. I lived in Florida when I had my second child, and I had said to my husband, if anything happens, we're moving back, but he doesn't have a disability, but we moved back anyway for a job. But I think we offer the best. We do work together. There's the Ohio Association of County Boards where we partner with other counties throughout the year. We also have what's called a SWOCOG that is made up, Patricia's at 5 counties that they get together and they pull funds and they work on projects together. So there's a lot of intermingling, I would say. For example, the Best Buddies program I was talking about, I didn't even know there was a county called Washington County, but I'm having a meeting on Zoom tomorrow. Somebody from their county wanted to know about starting Best Buddies. And since I work on the board, or I'm a chair for Best Buddies Ohio, he said, would you talk to me? And I said, sure. So I think there's a lot of working together. And then I know there's 88 superintendents, one for every county. They get together on a regular basis. They work on stuff together, things that they're working on, sharing ideas. So I think there's every county does things a little different as far as their allocation of funding, or maybe their waiting lists are different by and large. And I think Butler County is the best. So
Well, I was actually going to make a comment. We work mostly with Butler County Board of DD, but we work with some other county boards too. And though I think that the entire state of Ohio does fantastic things, that you would be hard pressed to find a better county board than Butler County Board of DD. They're absolutely fantastic, and in comparison to some of the others. Anyways, not enough good things to say about them. So.
Well, we try to be, pave the way for new and innovative things, and not think everything that we've done has been perfect, but I think we're good at being person-centered. The big thing is about the money following the person. And back in the olden days, when I started working here, we had like all the workshops, and all the folks went to the workshops, and those closed down and everything was privatized. And one reason what it did it that way was so people could have more choice. Courtney has a budget, don't you, Courtney?
Yeah.
And you want to tell them how you choose to use your budget? What kind of things you use your budget for?
I use it for transportation to and from work, and also to get HPC services, which means having a provider who comes and helps me.
you know, like at her house, take her to the grocery store, or Courtney has trouble with a few cleaning things just because of balance, right, Courtney? So like it's hard for her to clean her bathtub or whatever. So they'll help her with things that she needs. So that gives Courtney the support. Courtney doesn't have a roommate. Everybody knows her when I go over there. They know Courtney over the maintenance guys, the people coming in and out. There's a bartender that works at Casual Pint that knows Courtney. She doesn't go to Casual Pint. Courtney doesn't, but I do. And speaking of, can I give a plug about Casual Pint? On November the 11th, which is a holiday, I know, I think the chamber, you guys closed for Veterans Day? No, you're not. Well, we're closed, but I will be at Casual Pint that day. We are doing a fundraiser for Best Buddies Miami University. Anytime you come there from 12 till close, we will get 10% of whatever you purchase as far as dollar amount. And then from about 4 to 8, I'm going to be down there, and hopefully some of our college students and matches. And I know I will be there with my match, and my husband will, because we all love the craft beer. And we're going to be hopefully recruiting some community members that might want to join our citizens program. So we love the fact that they are great at giving back, and they chose us for November. And can't wait to go. I've got to drop off some stuff there today. So if you want to come out, or if there's a way you could advertise it for us, I don't know if we can, but if I share it on my Facebook and I'm friends with all you guys, can you please share it? So that was my plug. Sorry. Kim, should I do a plug for you too? If you need any holiday stuff, get out to Inside Out Studios.
I'll never say no to that, Connie.
Well, and we have quite a few of our best buddies who are artists there. And I actually have a big bag from Inside Out Studios sitting in my office right now. So my husband has forbade me to go down there anymore. Please lock your purse in the car when you go, if you're picking up something, because I'm always spending money. But everybody, if you haven't been there, make sure you stop in and check them out. Anything else?
Well, Connie, you can definitely add your fundraiser event to the Chamber's calendar. So if you go to our
Okay.
hamilton-ohio.com, submit events, or if you go through your back office and log in there, you can add information there. And Patricia, I think you and I probably need to touch base. I see some things we can tweak up on your chamber profile, so get you a little more visibility there probably too. So any more questions for Connie? I think this has been amazing information. Thank you, Courtney, for coming. We appreciate you taking some time. I think I see some partnership ideas, Connie. I got a few wheels turning up here. So hopefully we can make some connections for you. It sounds like some amazing things you all are doing, and we definitely need to get it out and share the information a lot more, it sounds like.
Well, we appreciate you having us today. We just love spreading the word about inclusion and helping everybody be a part of our community. So
yes, great. So we will be back here for Coffee and Conversations in 2 weeks, November 12th, 9 to 10 a.m. So check out what we've got planned for that day. And thank you, Connie and Patricia and Courtney. We appreciate you all taking time with us, and we will see you all in a couple weeks.
thank you.
Bye, everybody.
Bye.
Bye.